How to heal tennis elbow with self-massage. So what you have here is you have a bunch of muscles here that come along here, narrow up to a tendon and attach to that bone.
Right there.
So if you overuse this muscle, and there's also some restrictions that possibly could cause this that we're going to talk about, you can get increased soreness and actually some micro tears.
Sure.
Here's the bump. Usually it's right off the bump
Yep.
towards the hand, and you'll find the tender spot there, and just lightly go over it to start. I put finger over top of finger. Give me a little
Now, if
leverage.
it's flared up, I know from experience it doesn't take much. It's very tender, and then you don't want to go over it if it really hurts. You're going to go away from it more towards the muscle,
Right.
and work away from it, and then you work your way towards it as it improves. That might take a few days.
The cue here is what you're looking for is after 30 seconds, if the pain is getting worse, it's too early for this. You're not allowed to do that yet.
Yep.
If it is fine after 30 seconds, it gets numb or it's starting to plateau, you can keep doing it. You actually just put pressure on the tendon and go like this, lift the wrist up.
Okay.
And that's just starting to put some stress on that tendon
Sure.
without putting so much that it increases the pain.
So it should feel a little bit better with the pressure on.
It should feel better. It shouldn't make it worse. And it definitely should make it worse.
Sure. At an angle, so we got going across the fibers, which run this way. And then you can work that, and you may find some of these muscles actually get knotted up as a result of this injury. So you want to get those knots out. And, after the longer you do it, you should feel those knots relax and release, we call it, and work your way closer.
For what we're finding is that with a lot of people, they're lacking internal rotation at the shoulder.
Sure.
And so, like if you're playing tennis and you're doing a backhand and you don't have enough internal rotation, you're going to make up that somehow by working the wrist harder. It's actually internally rotating that shoulder. And it's always interesting to compare one side to another. Like you may find that your involved side can only go up this high, whereas uninvolved side can go up that high. And that's an indicator right there that, you're lacking internal rotation.
Yeah.
Or you might be lacking on both sides.
And then you just work it up.
You can work on internal rotation just like you were with the strap.
So we're using the Booyah stick, which we're really well for this, but you don't have to have one. You can use a piece of doweling or a handle from
PVC by pronation or supinations. You can check this out real easy too, Brad. You put your elbows into your side, and you might even take a ruler to go across to show, because your hand might go like that, but the wrist doesn't get all the way flat. You want to get them almost flat. And that'd be both ways. So it's a really easy stretch to do. First one, all you do is bend your elbow all the way up to flexion, and then you're gonna stretch it into pronation, and you're gonna stretch it into supination. 10 times.
You don't have to remember what's pronation
you
and
don't have
supination.
to just turn it both ways. Your hand, you're gonna actually point the fingers toward yourself, so you're kind of doing a contortionist here. You take the crook of your elbow, go right below the bump here, and you push it. You're going to actually push this bone out that way, out to the side. 1, 2, you can do it 10 times. 3,